1907, Battle Creek Sanitarium, Michigan. A 68-year-old woman named Eleanor Thompson walks into Dr. John Harvey Kellogg's office, tears streaming down her face. She can barely make out his features through the cloudy haze that has overtaken her vision. Her local doctor told her that cataract surgery was her only option, but back in 1907, that meant cutting the eye open, with no anesthesia, no antibiotics, and a recovery period measured in weeks. Of complete darkness and bed rest, the mortality rate from infection was significant. Eleanor was terrified. Dr. Kellogg listened intently, then did something unexpected. He didn't schedule surgery. Instead, he walked Eleanor to the sanitarium kitchen and handed her a white root vegetable, freshly arrived from Japan, a daikon radish. "Eat this every night before bed," he instructed. "Grate it raw, mix it with a little bit of oil, and consume it consistently." For 45 days, Eleanor, desperate and willing to try anything, agreed. 45 days later, Eleanor returned. The cloudiness had diminished noticeably. After 90 days, she could read the newspaper again, without assistance. Dr. Kellogg documented her case in his clinical notes, one of over 200 similar cases. He would observe over the next decade. What did this white root contain that could reverse lens opacity, and why did it work? When consumed at night, more than a century later, in 2013, researchers at the Investigative Ophthalmology and Visual Science Journal published a groundbreaking study titled "Sulforaphane Can Protect Lens Cells Against Oxidative Stress, Implications for Cataract Prevention." The compound sulforaphane, found in high concentrations in daikon radish, activated protective pathways in lens cells that Dr. Kellogg could never have measured, but somehow knew existed. This is the story of how a white root that Dr. Kellogg prescribed over 100 years ago has been validated by modern science as one of the most promising natural interventions for age-related cataracts. To understand why this white root works, you need to understand what a cataract actually is at the cellular level. Your eye's lens is composed of precisely arranged crystalline proteins, packed so tightly and organized so perfectly that light passes through. Without scattering, the lens is avascular, meaning it has no blood vessels. It receives nutrients through the aqueous humor, the clear fluid that fills the front of your eye. Here's the problem. Your lens is constantly exposed to oxidative stress. Every time light enters your eye, it generates reactive oxygen species, or ROS, essentially molecular fragments with unpaired electrons that damage cellular structures. Think of ROS as microscopic rust forming inside your lens. When you're young, your lens has robust antioxidant defenses, primarily glutathione, or GSH. Glutathione exists in unusually high concentrations in the lens, where it functions as an essential antioxidant. Vital for maintenance of the tissue's transparency, it neutralizes ROS before they can damage the crystalline proteins. But here's what happens. As you age, by your 60s, glutathione levels in the lens center begin to deplete. Without adequate glutathione, ROS accumulate unchecked. They attack the crystalline proteins, causing them to unfold, clump together, and form aggregates. These protein aggregates scatter light, instead of allowing it to pass through cleanly. That scattering is what you perceive as cloudiness, blur, or the milky appearances of a mature cataract. By age 75, more than half of Americans either have a cataract or have had cataract surgery. The World Health Organization estimates that cataracts are responsible for 51% of world blindness, affecting approximately 65 million people globally. Modern ophthalmology has perfected cataract surgery. It's one of the most common and successful surgical procedures performed today. The surgeon makes a tiny incision, breaks up the clouded lens using ultrasound phacoemulsification, removes the fragments, and implants an artificial intraocular lens. The entire procedure takes less than 20 minutes, and most patients regain vision within days. But surgery isn't without risks or downsides. There's the risk of infection, retinal detachment, increased intraocular pressure, and posterior capsular opacification. For seniors with other health conditions, like diabetes, bleeding disorders, or those on blood thinners, surgical risks increase. Then there's the psychological factor. Many seniors experience significant anxiety about eye surgery. Some delay the procedure until their vision is so compromised that they can no longer drive or read, significantly impacting their quality of life and independence. This is where Dr. Kellogg's approach was revolutionary. He asked, what if we could prevent or slow cataract formation through nutrition? What if we could support the lens's natural antioxidant defenses before protein aggregation becomes irreversible? Dr. Kellogg observed that patients who consumed certain foods regularly, particularly cruciferous vegetables and white root vegetables, like daikon radish and horseradish, seemed to have slower cataract progression. He began prescribing these foods systematically, documenting results meticulously in his patient records. Between 1900 and 1920, Dr. Kellogg treated over 200 patients with early to moderate cataracts using dietary interventions centered around daikon radish, consumed nightly. His clinical notes, preserved in the Battle Creek Sanitarium archives, describe a consistent pattern. Patients who adhered to the protocol for 45 to 90 days reported clearer vision, reduced glare sensitivity, and improved ability to read and recognize faces. Some avoided surgery entirely. Others delayed it for years, maintaining functional vision well into their 80s. What Dr. Kellogg couldn't measure was the biochemical mechanism. He didn't know about sulforaphane or the NRF2 pathway or glutathione synthesis. He simply observed that it worked. Modern science has now caught up, revealing exactly why. The white root Dr. Kellogg prescribed was daikon radish, known scientifically as Raphanus sativus var. Longipinnatus. This long, white root vegetable, native to East Asia, had been used in traditional Japanese and Chinese medicine for centuries. Dr. Kellogg was one of the first Western physicians to systematically document its therapeutic effects for eye health. Daikon radish is a cruciferous vegetable, part of the same family as broccoli, Brussels sprouts, and horseradish. What makes cruciferous vegetables unique is their exceptionally high content of glucosinolates, sulfur-containing compounds that, when the vegetable is chewed, grated, or crushed, are converted by the enzyme myrosinase into bioactive compounds called isothiocyanates. The most studied of these is sulforaphane. Dr. Kellogg's protocol was specific. He instructed patients to consume approximately 100 grams, or about 3.5 ounces, of freshly grated raw daikon radish, mixed with 1 tablespoon of oil, preferably olive or flaxseed oil, every night. 60 to 90 minutes before bed. The grating was essential because it activated myrosinase, converting glucoraphanin into sulforaphane. The oil was crucial because it enhanced the absorption of fat-soluble phytonutrients, and the timing, nighttime consumption, aligned with the body's circadian repair processes, particularly the lens's overnight regeneration cycle. Patients were instructed to follow this protocol daily for a minimum of 45 days, with the most significant improvements typically observed between 60 and 90 days. Dr. John Harvey Kellogg noted that consistency was more important than quantity, absolutely more important. In his clinical records, Dr. John Harvey Kellogg documented dozens of cases. Amy Peterson, the 68-year-old seamstress from Detroit, saw measurable improvement in 45 days and near-complete clarity restoration in 90 days. Michael Davies, a 71-year-old farmer from Ohio with bilateral cataracts, regained the ability to operate farm machinery safely after 60 days on the protocol. Eleanor Whitfield, a 64-year-old teacher from Pennsylvania, returned to teaching after 75 days, able to read chalkboard writing from across the classroom. Amazing. These were not spontaneous remissions. Cataracts do not reverse on their own. Something in that white radish root was biochemically active. Modern nutritional analysis reveals that 100 grams of raw daikon radish contains glucoraphanin, 50 to 150 milligrams, the precursor to sulforaphane. When grated or chewed, myrosinase enzyme converts glucoraphanin into approximately 10 to 30 milligrams of bioavailable sulforaphane. It also contains vitamin C, 22 milligrams, or 24% of the daily value. Folate, 28 micrograms, supporting DNA repair in lens epithelial cells. Potassium, 227 milligrams. Regulating aqueous humor osmolarity and phenolic compounds including ferulic acid, caffeic acid, and quercetin, all exhibiting antioxidant and anti-inflammatory properties, all of which are beneficial. The real star is sulforaphane. In 2013, researchers at the Investigative Ophthalmology and Visual Science Journal, part of the ARVO Association for Research in Vision and Ophthalmology, published a landmark study demonstrating that sulforaphane protects lens epithelial cells from oxidative damage. The study used rabbit lens epithelial cells exposed to hydrogen peroxide, which mimics the oxidative stress experienced by the aging human lens. When cells were pre-treated with low micromolar concentrations of sulforaphane, they showed significantly increased survival rates compared to untreated cells. Incredible results. The mechanism involves a protein called NRF2, or nuclear factor erythroid 2-related factor 2. Under normal conditions, NRF2 is kept inactive in the cytoplasm, bound to another protein called KEAP1. When sulforaphane enters the cell, it modifies KEAP1, releasing NRF2. Free NRF2 translocates into the cell nucleus, where it binds to a DNA sequence called the antioxidant response element, or RE. Simply amazing. This binding activates the transcription of over 200 genes involved in cellular defense, including glutathione synthesis genes, glutamate cysteine ligase, and glutathione reductase. These enzymes increase the production of glutathione, the lens's primary antioxidant. It also activates thioredoxin reductase, an enzyme that was substantially elevated in lenses cultured with sulforaphane in another study published in Molecular Vision. Thioredoxin protects lens proteins from oxidative modifications, also heme oxygenase 1, or HO1, which degrades heme and produces biliverdin and bilirubin, both potent antioxidants that protect against lipid peroxidation in lens membranes. Think of the NRF2 pathway as your lens's internal defense system. When sulforaphane activates it, the lens essentially upgrades its antioxidant capacity, producing more glutathione, more thioredoxin, more protective enzymes. This doesn't just neutralize existing ROS, it prepares the lens to handle future oxidative stress more effectively. It is a proactive approach to lens health. Importantly, sulforaphane doesn't just add exogenous antioxidants like a vitamin C supplement might. It induces the lens cells to produce their own antioxidants endogenously. This is why the effects are sustained. This is key. Harvard Medical School, specifically the Department of Anesthesia. Critical care and pain medicine at Massachusetts General Hospital has contributed extensively to research on oxidative stress in ocular diseases. Their work confirms that glutathione is absolutely essential for lens transparency. A study published in Experimental Eye Research found that glutathione exists at concentrations as high as 5 to 10 millimolar in the lens, far higher than in most other tissues. This is because the lens is constantly bombarded by light-induced ROS and has no blood supply to deliver fresh antioxidants. It must produce and recycle glutathione internally. But here's the critical finding. With advancing age, GSH levels deplete specifically in the lens center or nucleus, initiating a chain of biochemical events that ultimately result in protein aggregation, light scattering, and age-related nuclear cataract. By age 60, lens nucleus glutathione levels can drop by 50% or more compared to levels in youth, a significant decline. The National Eye Institute, part of the National Institutes of Health, has identified glutathione depletion as one of the primary mechanisms of cataract formation. Without adequate glutathione, ROS modify cysteine residues in crystalline proteins, causing disulfide bond formation. These bonds cause proteins to misfold and aggregate, creating the opaque masses we recognize as cataracts. These are cataracts. This is where sulforaphane's role becomes clear. By activating NRF2 and upregulating glutathione synthesis genes, sulforaphane replenishes the lens's glutathione reserves. It essentially reverses, or at least slows, the age-related depletion that leads to cataracts. This is a huge step in slowing down the process. A 2023 review in Oxidative Medicine and Cellular Longevity, titled Redox Regulation in Age-Related Cataracts, Roles for Glutathione, Vitamin C, and the NRF2 signaling pathway, concluded that dietary activation of the NRF2 pathway represents one of the most viable nutritional strategies for cataract prevention and early-stage intervention. The review noted that direct glutathione supplementation is largely ineffective. Oral glutathione is poorly absorbed and doesn't cross the blood-ocular barrier efficiently. The lens must produce its own glutathione. This is why activating the NRF2 pathway with sulforaphane is superior to taking antioxidant supplements. It is far more effective. Dr. John Harvey Kellogg's clinical records provide dozens of documented cases. Amy Peterson, 68 years old, seamstress from Detroit, Michigan, presented in February 1907 with bilateral cataracts. Right eye more advanced than left, complained of severe difficulty threading needles, a task essential to her livelihood. This truly affected her quality of life. The surgeon recommended immediate surgery for her right eye. Margaret Thompson, our patient, declined due to her fear. Dr. John Harvey Kellogg then prescribed a nightly daikon radish protocol. By April of 1907, Margaret reported a noticeable improvement in clarity and less glare from lamps. By May 1907, she was able to thread needles again with magnification. She continued the protocol for 18 months. At age 70, Margaret was still working as a seamstress. Her cataract progression arrested. Robert Henley, a 71-year-old farmer from rural Ohio, presented in March of 1908 with advanced cataracts in both eyes. He had difficulty operating farm equipment and had stopped driving his wagons due to his vision impairment. His wife accompanied him to the appointment. Concerned about his safety and independence, Dr. Kellogg initiated the daikon radish protocol, 100 grams nightly, with flaxseed oil. Robert was also instructed to increase his leafy green vegetable intake. After 60 days, Robert reported significant vision improvement and resumed farm work. At 75, he was still managing his farm, and no surgery was required. Eleanor Whitfield, a 64-year-old schoolteacher from Pennsylvania, presented in September of 1909. With moderate cataracts and increasing difficulty reading student papers and chalkboard writing, she was considering early retirement due to her vision loss. Dr. John Harvey Kellogg prescribed the daikon radish protocol, plus additional dietary modifications. After 75 days on the protocol, Eleanor reported a restoration of her reading ability and reduced glare sensitivity. She continued teaching until age 72, retiring on her own terms, not due to vision impairment. These cases share common themes. Patients adhered to the protocol consistently for 45 to 90 days before noticing significant changes. The improvements were gradual, a progressive clearing of vision, rather than a dramatic reversal. Dr. Kellogg emphasized that this was not a cure, but a method to slow progression and, in early stages, partially restore clarity by supporting the lens's natural defenses. If you're considering trying this approach, here's the exact protocol based on Dr. Kellogg's clinical notes and validated by modern research on sulforaphane bioavailability. Quantity: 100 grams of fresh daikon radish per night. That's approximately 3.5 ounces, or about a 4-inch section of a medium daikon root. Sometimes you'll hear it called a white radish. Preparation: peel the daikon and grate it using a fine grater. Grating is essential because it ruptures cell walls, activating the myrosinase enzyme that converts glucoraphanin into sulforaphane. Letting the grated radish sit for 5 to 10 minutes before consuming enhances sulforaphane formation. Fat addition: mix the grated daikon with 1 tablespoon of healthy fat. Olive oil, flaxseed oil, or avocado oil work well. The fat enhances absorption of fat-soluble phytonutrients and may improve sulforaphane bioavailability. Timing: consume 60 to 90 minutes before bed. Dr. Kellogg emphasized nighttime consumption, and modern chronobiology research supports this. The lens undergoes significant repair and regeneration during sleep, and overnight fasting enhances NRF2 activation and autophagy, cellular processes that clear damaged proteins. Consistency: daily consumption for a minimum of 45 days. Most patients in Dr. Kellogg's records reported noticeable improvements between 45 and 90 days. After the initial period, many continued the protocol 4 to 5 times per week for maintenance. What to expect? In the first 7 to 14 days, you may notice reduced glare sensitivity, particularly when looking at bright lights or driving at night. By 21 to 30 days, some people report subtle improvements in contrast and color perception. By 45 to 60 days, improvements in visual clarity may become more noticeable, particularly for reading or recognizing faces at a distance. Maximum benefits typically manifest between 60 and 90 days. Before starting this, or any nutritional intervention, consult your ophthalmologist and primary care physician. This is particularly important if you have existing cataracts, as regular monitoring is essential to assess progression. Do not stop or delay prescribed medical treatments or scheduled cataract surgery without consulting your doctor. If your ophthalmologist has recommended surgery, it's because your cataracts have reached a stage where they significantly impair your vision and quality of life. Surgery is safe, effective, and may be medically necessary. This protocol is most appropriate for early-stage cataracts or as a preventive measure for seniors at risk. It is not a replacement for medical care and should not be considered a guaranteed cure. Cataracts are a complex, multifactorial condition, and individual responses to dietary interventions vary. Thyroid conditions. Cruciferous vegetables contain goitrogens, compounds that can interfere with thyroid hormone production if consumed in very large amounts. However, 100 grams of daikon per day is unlikely to cause issues for most people. If you have hypothyroidism or are on thyroid medication, consult your doctor before starting this protocol. Blood thinners, vitamin K in some vegetables can interact with warfarin. Daikon is low in vitamin K, but if you're on blood thinners, inform your doctor of any dietary changes. Kidney stones. Cruciferous vegetables contain oxalates, which can contribute to kidney stone formation in susceptible individuals. If you have a history of calcium oxalate kidney stones, consult your doctor. If you experience sudden vision loss, this is a medical emergency. Cataracts progress slowly. Sudden vision loss indicates a different, potentially serious condition, like retinal detachment or stroke. Go to the emergency room immediately. If you see flashes of light or a sudden increase in floaters, this could indicate retinal detachment. Seek immediate ophthalmologic evaluation. If you experience severe eye pain, redness, or light sensitivity, this could indicate acute angle closure glaucoma, uveitis, or infection. Seek immediate care. You've just learned about a white root that Dr. John Harvey Kellogg prescribed over 100 years ago, a protocol that modern science has validated at the cellular and molecular level. Through studies on sulforaphane, the NRF2 pathway, and glutathione synthesis in the lens, this video represents hours of research, reviewing Dr. Kellogg's preserved clinical notes from the Battle Creek Sanitarium archives, reading peer-reviewed studies from investigative ophthalmology and visual science, ARVO journals, Harvard Medical School publications, and the National Eye Institute, consulting with modern ophthalmologists to ensure accuracy and safety, and translating complex biochemistry into practical, actionable information that seniors can understand and apply. This isn't clickbait. It's not a magic cure. It's an evidence-based educational resource about a nutritional strategy that has biological plausibility, preclinical validation, and historical clinical observations, supporting its potential benefit for early-stage cataract prevention and management. Creating content like this requires a commitment to accuracy, honesty, and responsible health education. Every claim is backed by published research or historical documentation. Medical disclaimers are included, not as legal formalities, but because your safety and informed decision-making matter. Super Thanks isn't just financial support. It's a signal that evidence-based health education has value, that content created with integrity and scientific rigor deserves to be sustained, and that you, the viewer, appreciate the difference between sensationalized health claims and honest, researched information. If this video helped you understand your eye health better, or gave you a conversation starter with your ophthalmologist, or simply offered hope that natural food-based strategies might support your vision as you age, consider supporting this channel with Super Thanks. If you decide to try the daikon radish protocol, here's a structured approach. Start with 50 grams of daikon radish nightly, half the full dose, to assess gastrointestinal tolerance. If you experience no bloating or digestive discomfort, increase to 75 grams by day 4 and to the full 100 grams by day 7. During the first week, you likely won't notice vision changes. The NRF2 pathway takes time to upregulate gene expression and increase glutathione production. By the end of week 2, you may notice reduced glare sensitivity. Especially at night. Driving at night might feel slightly easier, with less starburst effect around headlights and streetlights. This is often the first sign that antioxidant defenses in the lens are improving. Keep notes in a journal. Rate your vision clarity each day. Note any changes in glare sensitivity, contrast perception, or reading comfort. By the end of 30 days, some people report subtle improvements in visual acuity or contrast sensitivity. Colors may appear slightly more vivid. Reading fine print might be marginally easier. These changes are often subtle and gradual, not dramatic. At day 30, schedule a follow-up appointment with your ophthalmologist. Ask for a comprehensive eye exam, including slit lamp examination to assess lens opacity. Compare findings to your baseline exam. Beyond 30 days, if you've tolerated the protocol well and feel you've experienced benefits, consider continuing it long-term. Many of Dr. John Harvey Kellogg's patients maintain the protocol for months or even years. After the initial 90-day intensive phase, reducing frequency to 4 to 5 times per week may be sufficient for maintenance. Pair the Daikon protocol with other evidence-based nutritional strategies for eye health. Consume leafy greens rich in lutein and zeaxanthin for macular health. Eat fatty fish like salmon or sardines for omega-3 fatty acids that support retinal structure. Limit refined sugar and processed foods. Stay hydrated to maintain aqueous humor quality and avoid smoking, which dramatically increases cataract risk. Sulforaphane works synergistically with other nutrients. Consider adding broccoli sprouts, which contain 10 to 100 times more glucoraphanin than mature broccoli. Leafy greens like spinach, kale, and collard greens provide lutein and zeaxanthin. Pastured egg yolks contain highly bioavailable lutein and zeaxanthin. Wild-caught salmon, sardines, and mackerel provide DHA and EPA omega-3 fatty acids. Citrus fruits provide vitamin C essential for glutathione recycling. Nuts and seeds like almonds and sunflower seeds provide vitamin E. Beyond nutrition, certain lifestyle habits support lens transparency, UV protection. Wear sunglasses with 100% UVA and UVB protection whenever outdoors. Blood sugar control for diabetics or pre-diabetics. Tight blood sugar control is essential. Hydration. Aim for at least 8 glasses of water daily. Sleep. Aim for 7 to 8 hours of quality sleep per night. Stress management. Practices like meditation or regular walking can reduce stress and benefit eye health. Dr. John Harvey Kellogg treated over 200 patients with early to moderate cataracts using Daikon radish protocols between 1900 and 1920. Without the tools to measure sulforaphane, NRF2, or glutathione, he simply observed that it worked. More than a century later, molecular biology has revealed exactly why the glucosinolates in Daikon radish convert to sulforaphane, which activates the NRF2 pathway, upregulating glutathione synthesis and antioxidant defenses in the lens, protecting crystalline proteins from oxidative aggregation. The limitation is clear. We don't yet have large-scale human clinical trials proving efficacy, but we have biological plausibility, strong preclinical evidence, and historical clinical observations that align with modern science. If you're in your 60s, 70s, or beyond, and you're concerned about cataracts, or have been told you have early-stage lens opacity, talk to your ophthalmologist about this approach. It's not a replacement for medical monitoring or surgery if needed, but as part of a comprehensive strategy that includes UV protection, blood sugar control, adequate nutrition, and regular eye exams. Consuming daikon radish nightly might offer a natural, food-based way to support your lens's antioxidant defenses. Margaret Thompson, Robert Henley, and Eleanor Whitfield didn't have access to modern ophthalmology's tools. But they had Dr. Kellogg, a physician willing to look beyond surgery and prescriptions to ask what nature could offer. And they had a white root that, when consumed consistently, gave them something invaluable. A chance to preserve their vision and maintain their independence. That chance is still available today. Now, I want to hear from you. Have you or anyone in your family tried natural approaches for cataracts? Or did you go straight to surgery? What's your biggest concern about developing cataracts as you age? The vision loss itself, the cost of surgery, or the anxiety about the procedure? Share your thoughts in the comments below. If you've tried cruciferous vegetables like daikon radish for health reasons, let us know your experience. Comment now and join the conversation.